I'm Katrina, and I'm in the Medicare department at Select Health, and we're going to spend a few minutes today talking about Medicare and how it works. We realize Medicare is very confusing, so we're going to talk through a few of the questions that most commonly get asked about Medicare. We're going to talk about, turning 65, what do I need to do? We're going to talk about the ABCs of Medicare, and we're going to talk about what if I'm on Medicare and I move? How does that work? So let's delve into these questions for just a few minutes. So what about if you're turning 65? Well, there are people that when they turn 65, they do need to go to Medicare. Typically, if you're on an individual plan or if you're on a marketplace plan, you do need to go to Medicare at 65. But if you're still working or your spouse is still working and you're on a large employer group plan, you are not required to go to Medicare at 65. So there's often some confusion around that. But depending on what your individual situation is, that will determine whether you need to go to Medicare at 65 or not. So let's talk for a minute about the ABCs of Medicare and how they work. So Medicare Part A is the hospital part of Medicare. That's the part that you earn. You earn Medicare Part A by working 10 years or 40 quarters throughout your lifetime, or being married to somebody who did. So in my own family situation, my dad worked, my mom stayed home with kids, so my mom earned Medicare Part A because she's married to dad and dad paid FICA taxes. Medicare Part B is the doctor part of Medicare. Medicare Part B is the part that you have a cost for. The cost of Medicare Part B is directly related to your household income. So if you file taxes jointly and your household income is not greater than $170,000 a year, then you will pay $134 per person per month for Medicare Part B. That is if you're coming on to Medicare in 2018. So A and B come only from the federal government. There is no other place to get Medicare A and B than from the federal government. Medicare Part C is a Medicare Advantage plan. And a Medicare Advantage plan means it's a plan that's offered by a private insurance company. So when someone enrolls in a Medicare Advantage plan, in essence, they're telling the government, I would like that company to administer my benefits under Medicare. The government then steps away, and that company is then responsible for the administration of your benefits under Medicare. Medicare Part D is the drug part of Medicare. Medicare Part D can be had as part of a benefit of an Advantage plan, or if you're buying a supplement, it would be a separate freestanding drug plan that you would buy to go along with your supplement. So you're the one that determines exactly how you're going to access your Medicare once you've signed up for A and B. So let's just recap for a minute. Medicare A is the hospital part, you earn that. Medicare B you have a cost for, directly related to your household income. Medicare C is an Advantage plan. Medicare D is drug coverage. Now, what if you've moved? What if you always lived in the Midwest, or maybe you lived in Idaho and you came onto Medicare while living there, but now you've decided to move? The minute that you move outside of the service area for your current plan, that opens up a special enrollment period for you to then be able to enroll in a plan in the area that you've moved to. So know that it's not a life sentence. In essence, Medicare is a one-year choice. You're making a decision each year during Medicare's annual enrollment, the middle of October to the 7th of December, to decide what plan you're going to go with for the following year. But where can you get some more information? Well, there are a few different places you can go. You are welcome to give us a call here at Select Health. We're happy to talk through things with you. There's a book called Medicare and You. The government sends these out each year to people that are on Medicare. It's area specific and it's plan year specific. Very, very helpful book because it gives information about the plans that are available in your area. So you can call the government, you can call Medicare, you can talk to the local SHIP, S-H-I-P, so a State Health Insurance Program office. You're welcome to give us a call here at Select Health. We're happy to clarify any questions you have, sit down with you, talk through things, do a drug analysis to help you navigate Medicare. We realize it's very confusing, so feel free to reach out to us. We're happy to help with any Medicare questions. Thanks so much. Take care and have a great day.